Impact of online class learning on students' mental health status, a topic proposal prepared by the AWIT group. Rationale of this study. Mental disability or mental health issues have been neglected in the discourse around health, human rights, and equality way back. This is perplexing as mental health issues are pervasive, affecting approximately 8% of the world's population. Most especially in our country, which is the Philippines, where mental health are perceived as shallow and just a stereotype adopted and tagged in mockery at some before. Furthermore, the experience of persons with mental health issues is one characterized by multiple interlinked levels of inequality and discrimination within society. As the time goes by, mental health has currently emerged as an important public health concern in recent years. In the Philippines, the Philippine Mental Health Act came into force in 2019, and it is expected that the general public will be more concerned about mental health services and rights of patients and their families. With a high proportion of children and adolescents affected by mental disorder and issues, it is important to ensure that they are provided with proper care and treatment. Online learning environments have grown in popularity and alternative application in educational settings due to the coronavirus that has been spreading around the globe. This new way of learning has never done by the majority of students before, and that is why it is not surprising that it challenges the student not just physically but also mentally. An assessment of the Philippine mental health system reported a 16% prevalence of mental disorder among children. In addition, the latest global school-based student health survey found that 16.8% of students aged 13 to 17 attempted suicide one or more times during the 12 months before the survey. Hence, the mortality rate increases when the COVID-19 pandemic status enters the picture. Ensuring the mental health of students and teachers during the COVID-19 pandemic is a big challenge. The statement was also supported by the Department of Education Secretary Leonor Briones as she confirmed another one suicide of a student. As the school year continues, suicide cases are becoming more rampant due to the poor mental health status impaired by the new normal setup. This study was conceived within the context of incidents of mental health challenges observed due to the online learning. The researchers want to emphasize the importance of mental health and to oppose the stigma regarding the narrow perception of mental health issue. This research sought to examine how online class learning affect mental health status, investigate the factors associated, if there are any, during online class, and to determine the mental health status of the student during online class of the second-year college medical technology students of St. Mary's University. Aside from the new normal setup situation that pushes the researchers to choose this topic, there are also other reasons why they choose the presented topic. The other reason why the researchers choose this topic is because it is the common denominator of the researchers itself. It is one thing that all of them can relate to. And coincidentally, they also came with the topic during the month of September, which is known as the National Mental Health Awareness Month. Let us now proceed to the statement of the problem. The general objectives. This research aims to discover the impact of online class learning on students' mental health status. Specifically, it aims to answer the following question. Number 1. What is the demographic profile of the respondents in SMU in terms of age, sex, and economic status? Number 2. What is the effect of online class learning towards the student's mental health status? Number 3. What are the factors that triggers the impact of online learning program of the student's mental health? Number 4. Is online class learning effective as an alternative application of education setting? Proceeding in research methodology. In this section, it deals with the procedures and methods that were used in the study. This chapter briefly discusses the research design, respondents of the study, locale of the study, data gathering instrument, tentative questionnaires, and data analysis or interpretation use of the research topic. Research design. This study, entitled Impact of Online Class Learning on Students' Mental Health Status, is both qualitative and quantitative research, and it also uses descriptive as an approach. On one hand, it is intended to gain a richly detailed understanding of the presented topic, and it is also concerned with establishing answers to answer the whys and hows of the rationale of the topic. On the other hand, it uses quantitative research design due to the numbers and statistics used to classify, count, and statistical model usage in attempt to explain the gathered data. Research locale of this study. The researchers conducted their study at St. Mary's University, Bayambong, Nueva Vizcaya. Research respondents. The researchers surveyed all of the second-year medical laboratory science students of St. Mary's University and picked 50 students using a random sampling method as their respondent in this research study. The first part is normally the demographic profile of the respondents. The second part is the mental health assessment, wherein it is intended to know the effects of online learning and discover the mental health status of the respondents. Another part is the attributes or factors of the effect, wherein to know or to reveal the coordinating factors that triggers the impact of online learning. The last part would be the effectiveness of online class, to determine the effectiveness of online class learning as well. The survey questionnaire were administered to the respondent using Google Forum as a platform. Data gathering instrument. The researchers distributed an adopted questionnaire to the respondents under the second-year Medical Technology Department of SHANS in St. Mary's University. The main tool in gathering the required data was a rating scale questionnaire and are divided into 3 parts to tease out the statement objectives. The following are the previews of the questionnaires used in the research study. Data analysis. The researchers used 2 kinds of data interpretation. The mental health assessment part consists of 12 items, each one assessing the severity of mental health using a 4-point Likert type scale from 1 to 4, 4 being the highest and 1 being the lowest. High scores indicate worse mental health. In retrieving the data in the part of effectiveness of online learning, the researcher used a 5-point Likert type scale from 0 to 4, 4 being the highest and 0 being the lowest. In interpreting the data, high scores indicates higher chances of effectiveness of online classes learning. Significance of the findings was revealed through the use of the descriptive statistical analysis because it involves method of organizing, summarizing, and presenting data of samples. Before ending the topic proposal presentation, I am Maureen Balogan, and this is the AWIT group.